during muscular exercise also it will lead to increase in RBC count, because at that time oxygen demand of the blood cells will increase, of the body cells will increase. Increase in temperature of environment, loss of body water, injections of adrenaline and excitement, carbon monoxide poisoning, bone marrow cancer. All these are the reasons behind the polycythemia. Okay. Now next disorder related with RBC is anemia. So what is this anemia? So this anemia is a symptom complex or the disease recognized by a fall in oxygen carrying capacity of the blood. We have seen that this hemoglobin, which is the respiratory pigment present in red blood cell, hemoglobin carries oxygen from lungs to billions of body cells. So if there is fall in hemoglobin percentage, if there is fall in RBC count, so there will be fall in oxygen carrying capacity of blood. So this fall in oxygen carrying capacity of blood, this condition is known as anemia. Okay, what is anemia? Anemia is a symptom complex or disease recognized by a fall in oxygen carrying capacity of blood. Symptoms of anemia are paleness, weakness, breathlessness, restlessness, and loss of appetite. It is recognized by fall in hemoglobin percentage, RBC percentage, or fall in both RBC as well as hemoglobin percentage. Okay. Now, what are the causes of anemia? Why anemia results? Causes of anemia. So, anemia may also result due to post-hemorrhagic. One of the type of anemia is post-hemorrhagic anemia. So, it is due to hemorrhage or loss of blood. If there is loss of excessive amount of blood from the body, it may lead to post-hemorrhagic anemia. In this type of anemia, hemoglobin content per red blood cell and the size of the red blood cell will be normal, but fall in red blood cell count, hemoglobin percentage will be there. Post-hemorrhagic anemia. Next is hemolytic anemia. Hemolytic anemia results due to the hemolysis of red blood cells. So, excessive or abnormal destruction of red blood cell. Excessive or abnormal destruction of red blood cell will lead to hemolytic anemia. So, in the chronic malaria, if person is suffering from malaria, so due to chronic malaria, it may lead to hemolytic anemia. So, anemia will result due to destruction of red blood cell, that is known as the hemolytic anemia. Next type of anemia is nutritional anemia. Nutritional anemia. So, nutritional anemia results due to the deficiency of iron, folic acid, vitamin B12 and protein in diet. Among them, iron deficiency anemia or vitamin B12 deficiency anemia is very common. Okay, iron deficiency anemia and vitamin B12 deficiency anemia are very common. Aplastic anemia. Aplasia means incomplete tissue formation. That results, this type of anemia results due to the failure of bone marrow function. This may result due to poisoning by X-ray, aromatic organic chemicals, toxins, cancer, and the drugs like chloramphenicol. Okay, so these are the various types of anemia. Now we'll see the diagnosis of anemia. How we can diagnose that person is suffering from anemia. So one can diagnose anemia by examining the redness of mucous membrane of eyelids or tongue in nail. Okay. So if we examine the redness of mucous membrane of eyelid, tongue or nail, we can diagnose that person is suffering from anemia or not. What proper diagnosis of anemia can be made by finding out the color index of the blood. So we have to find out the color index of the blood, and from the value of color index anemia can be diagnosed. So now we'll see what is color index. Color index क्या है? ठीक है? So color index is defined as the relative amount of hemoglobin present in single red blood cell. Amount of hemoglobin present in single red blood cell is known as color index. Color index is the ratio of hemoglobin percentage to RBC percentage. Color index is the ratio of hemoglobin percentage and RBC percentage. So if we divide the hemoglobin percentage by RBC percentage, we will get the value of color index. Normal range of color index is 0.85 to 1.15. Okay. Normal range of color index is 0.15 to 1.15. So if the color index is less than 0.85, then that type of anemia is known as hypochromic anemia. And if the color index is more than 1.15, then that type of anemia is known as hyperchromic anemia. Okay, so in this way, this was regarding color index and the diagnosis of anemia. Now here again, based on the color index, there are again two types of this anemia: hyperchromic anemia and hypochromic anemia. So hypochromic anemia means color index, the value of color index will be less than 0.85. So if we find that the value of color index is less than 0.85, then we can say that person is suffering from hypochromic anemia. So what is this hypochromic anemia? What will be the symptoms in this case? So hypochromic anemia results due to the reduced amount of hemoglobin in red blood cell. So amount of hemoglobin present in single red blood cell will be less in amount than the normal value. So we can say that person is suffering from hypochromic anemia. So in this case, red blood cell, size of red blood cell will be less than the 7.2 micron. Normally, red blood cell, diameter of red blood cell is 7.2 micron. But in this case, hypochromic anemia, RBCs will be generally of smaller size. Less than 7.2 micron diameter will be there. So RBCs will be smaller in size than the normal size. That is why that type of anemia is also known as microcytic anemia. Microcytic anemia. Okay. Now, this type of anemia results due to the deficiency of iron in our diet. That is why it is also known as iron deficiency anemia. Person suffering from this type of anemia is advised to take more green leafy vegetables, which are the good source of iron. Or physician, if required, physician can prescribe the preparations containing iron, containing ferrous fumarate. So, preparation containing iron in ferrous form is prescribed because iron will be well absorbed from gastrointestinal tract in ferrous form. So, ferrous fumarate like preparations are prescribed to the patient suffering from this type of iron deficiency anemia. Okay. Now, other type of anemia based on this color index is hyperchromic anemia. Hyperchromic anemia is due to the defective RBC formation. Hemoglobin percentage, amount of hemoglobin present in single red blood cell will be more than the normal value. So, size of RBC will be usually large. RBC will be of larger size. Diameter will be more than 7.2 micron. So RBC is usually large in size in this type of anemia. That is why this type of anemia is known as macrocytic anemia. Okay. This type of anemia results due to the deficiency of vitamin B12 in diet. It is also known as vitamin B12 deficiency anemia or pernicious anemia. So, patient suffering from this type of anemia is advised to take the food which is a rich source of vitamin B12. Or physician will prescribe the preparations containing this vitamin. Okay. Other type of anemia are hereditary anemia. Hereditary anemia are also seen in some of the patients like sickle cell anemia, thalassemia. Sickle cell anemia, thalassemia, all are the hereditary anemia, which results from the specific genes which directs the synthesis of abnormal hemoglobin. Synthesis of abnormal hemoglobin will be there in the body, and that results because of the specific genes which are carried to the fetus from the parents. Okay. So all this was regarding the anemia, diagnosis of anemia and various types of anemia. Okay, now coming to blood groups. Blood group. So, as we have discussed that at the time of blood transfusion, it is necessary to match the blood group. So, when more than 40% of blood is lost within few hours by hemorrhage or so, then it is to be restored by intravenous infusion. This is known as blood transfusion. Okay. So, at the time of blood transfusion, it is necessary to match the blood group of donor and recipient. Donor means the person who donates the blood. So, it is necessary to match the blood group of donor and recipient. So, according to ABO's system of blood grouping, according According to this ABO system of blood grouping, there can be 4 blood groups: A, B, AB, and O. So these are the 4 blood groups: type A, type B, type O, and type AB. These are the 4 blood groups. Okay. Now, specific the blood group type is determined by type of agglutinogen present in RBC. Agglutinogen are the specific glycoprotein on red blood cell membrane. Okay. All the RBCs in an individual carry the same specific type of agglutinogen. So specific type of agglutinogen is present on the red blood cell membrane. So depending on the type of agglutinogen present on the red blood cell membrane, these are the 4 different blood groups: A, B, O, and AB. Okay. Type A blood group, red blood cell carries agglutinogen of type A. Type B blood group, red blood cells carry agglutinogen of type B. Type O blood group, RBCs carry no A or B agglutinogen. Okay. In the blood group type O, agglutinogen is absent, neither A nor B. Red blood cell carries no agglutinogen, neither A nor B. Agglutinogen is absent in the blood group type O. Okay. Now in the blood group type AB, both the type of agglutinogens are present, type A and type B. Both the type of agglutinogens are present. Is it clear to all of you?
Yes, ma'am. Yes, ma'am.
Okay. Now in the type A blood, red blood cell carries agglutinogen of type A. Okay. Now plasma contains specific agglutinin, that will be agglutinin of type B. Agglutinin B will be present in the type A blood. Now what happens? The agglutinogen A can react with agglutinin A, or agglutinogen B can react with agglutinin B, and it may lead to agglutination reaction. Clumping of red blood cell may take place, and then it will lead to death of the recipient also. So what this slide shows, okay, so this shows the agglutination reaction binding to agglutinogens that are not carried by host RBC. So this type of agglutination reaction may result due to mismatching of blood. That is why it is necessary to match the blood group before blood transfusion. Okay. So if the agglutination of red blood cell, clumping of red blood cell takes place in the recipient plasma. So here you can say this region shows the clumping of red blood cell, agglutinated RBCs that will block the small blood vessels It will block the arteries and veins in our body. So it may lead to death of the recipient also. That is why it is necessary to match the blood group of donor and recipient. So here there is a summary of ABO blood group. Okay, in the type blood group A agglutinogen will be A. Agglutinin will be of type B in plasma. In the blood type B, agglutinogen will be of type B, but agglutinin will be of type A. In the blood group O, agglutinogen is absent. Here none, neither A nor B absent. Agglutinogen is absent, but both the type of agglutinin A and B are present. Here in this case, blood group AB, both the type of agglutinogen A and B are present, but in the plasma, agglutinin are absent. Okay. Now, keeping in mind the presence of agglutinogen and agglutinin, we have to select the donor and recipient for the blood transfusion. So, person with blood group A, this blood group A will match with the blood group A, but it cannot donate the blood to B for recipient and for donor. Okay, so blood group A, person with blood group A can be donor to A and AB blood group. Person with blood group A can donate the blood to A. It cannot donate the blood to B, but it can donate the blood to AB. Same way, person with blood group B can be donor for D and OB. Person with blood group O can be donor for all. Person with blood group O can be donor from all, because person with blood group O is having no agglutinogen. That is why person with blood group O can donate the blood to all. That is why blood group O is known as universal donor. Now, person with this blood group type AB can be donor for AB only, because here you can see that in this blood both the type of agglutinogen A and B are present. So person with blood group AB can donate the blood to AB only. Okay. Now if we consider for being a recipient, so person with blood group A can receive the blood from A and from O, because in the O, agglutinogen is absent. Person with blood group B can receive the blood from B and O. Person with blood group O can receive the blood from O only, because in the blood group O you can see that here both the type of agglutinin are present in blood plasma. So person with blood group O can donate all. It can be universal donor, but person with blood group O can receive the blood from O only. Now blood group AB, here you can see here no agglutinin is present, neither A nor B. Agglutinin is absent in this case. So person with blood group AB can receive the blood from all the type. That is why AB blood group is known as universal recipient. Okay. AB is known as universal recipient. in this way, we have discussed the ABO system of blood grouping based on the type of agglutinogen present in a red blood cell, either A or B. Okay, now this is Rh blood group. So, apart from agglutinogen A and B, another agglutinogen was discovered in human red blood cell, that is known as the rhesus factor, that is known as the RH factor. ठीक है, जैसे सब लोगों का ब्लड ग्रुप किसी का A पॉजिटिव होता है, किसी का A नेगेटिव होता है, O पॉजिटिव, O नेगेटिव, B पॉजिटिव, B नेगेटिव, उस तरह से हम ब्लड ग्रुप लिखते हैं. तो पॉजिटिव नेगेटिव हम क्यों लिखते हैं? That is based on whether RH factor is present or not. Okay, so apart from this agglutinogen A and B, one more agglutinogen was discovered in human red blood cells, that is called the RH factor or rhesus factor. So blood having this RH factor is known as RH positive blood, and blood without this RH factor is known as RH negative blood. Okay, almost 90% of world population is Rh positive. This means that RBC in approximately 90% of the population contains Rh positive agglutinogen factor in their blood. So it is also advisable therefore to test the Rh factor in both the donor and the recipient. Okay. So if in the blood this Rh factor is present, then we can say that blood group is Rh positive. And if the Rh factor is absent, then we can say the group is Rh negative. So in this way you can see Rh factor is also present on the cell wall of the red blood cell. Okay, now what is the problem with this Rh positive, Rh negative in the mother and fetus? That case we'll discuss. So what happens? This is the case of Rh negative mother and the fetus is Rh positive. Mother is Rh negative, but the fetus is Rh positive. Okay, then what happens? So in case of Rh negative mother bearing Rh positive fetus, Rh positive antibodies will develop in mother's blood. So it is the specific property of Rh factor that if the person is Rh negative, but if the Rh positive blood enters in the body, then anti-Rh factor will be developed in the blood. So that is the specific property of this Rh factor. Okay. So here what happens that Rh factor, fetus is Rh positive, so Rh factor can travel from across the placenta. Rh factor will travel from fetus blood to mother's blood. Mother is Rh negative. Now what happens? Against the entry of Rh factor in the mother's blood, as such mother is Rh negative. So here in the mother's blood, anti-Rh factor will be developed. Now this anti-Rh factor again will cross the placenta, will enter in the body of the fetus, and it may lead to hemolysis. It may lead to hemolysis of red blood cell in the fetus. Okay. So it may lead means the baby will suffer from severe anemia because of the hemolysis of the red blood cell. So it will suffer, baby will suffer from severe anemia, or in severe case it may lead to miscarriage, abortion. It may lead to miscarriage, abortion also. And if the baby is born alive, then will suffer from severe anemia. So this type of complications may result because of this Rh factor. Okay. Now, next time we will discuss regarding the white blood cells in detail. Normal count of white blood cells, size and shape of the white blood cell, and various types of white blood cells also we will discuss next time. Okay. White blood cells, WBC, which are also known as leukocytes, that we will discuss in detail next time. ठीक है. So we have discussed various points in this chapter blood. तो क्लास में जितने भी टॉपिक्स पॉइंट्स कवर हो गए ब्लड वाले चैप्टर में, और धीरे धीरे तुम लोग घर पे प्रिपेयर करते रहो, क्योंकि एग्जामिनेशन पॉइंट ऑफ व्यू से ये चैप्टर जो है वो मोस्ट इम्पोर्टेंट है. ओके, सो विल मीट नेक्स्ट टाइम and we'll discuss further the remaining points in this chapter blood. Till then, stay home, stay safe, and goodbye to all. Achha, one more announcement is there that we have started fees collection for the second term. ठीक है, फर्स्ट टर्म का फीस जो है आप लोगों ने जब एडमिशन हुआ तब भरा था कॉलेज में, अभी सेकंड टर्म का फीस भरने का चालू हो गया है. तो जो भी स्टूडेंट्स हैं उनको कॉलेज में आके फीस भरना है तो भले कॉलेज में आके फीस भरे, और जो दूर है घर पे है स्टूडेंट्स जो आ नहीं सकते ट्रैवल करके बिकॉज ऑफ दिस कोरोना पोजीशन, तो वो हम लोग तुमको बैंक डिटेल प्रोवाइड करेंगे, तो घर पे बैठ के तुम ऑनलाइन भी फीस डिपॉजिट करा सकते हो. उसके लिए सुनीता मैडम जो है वो आपको गाइड करेंगे. बैंक डिटेल जो है हम ग्रुप में शेयर कर देंगे, कितना अमाउंट पे करना है वो भी हम ग्रुप में शेयर कर देंगे, और ऑनलाइन जो भी आप ट्रांजैक्शन करोगे हमारे अकाउंट में उसका फिर जो रिसिप्ट होगा, ठीक है, जो प्रूफ होगा ट्रांजैक्शन का, वो आपको व्हाट्सएप पे फिर सुनीता मैडम को शेयर करना रहेगा. ठीक है, तो सेकंड टर्म का फी जो है आप लोगों को सबको भरना होगा, उसका डिटेल जो है हम ग्रुप में शेयर करेंगे. ठीक है, सो टिल देन गुड बाय, स्टे सेम, स्टे होम, स्टे सेफ. एंड अगर आपको कुछ भी प्रॉब्लम हो तो हमारे साथ आप फोन पे कांटेक्ट कर सकते हो. ठीक है.